أعوذ بالله من الشيطان اللعين الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين والصلاة والسلام على محمد وآله الطاهرين. Dear sisters and brothers in Iman, Assalamu alaikum wa rahmatullahi wa barakatuh. Rajab, Sha'ban and Ramadan is our spiritual season. Unfortunately, the coronavirus crisis has upset our program schedules for these spiritual months. Now that we are coming closer to Ramadan, questions have started coming regarding common fasting issues as well as the new ones. One of the questions sent to me was, if the virus problem continues till Ramadan, would it be acceptable to skip fasting? Essentially, the answer is no. The vast majority of people who are not infected with the virus will have to go through fasting normally. A question was recently sent to the office of Grand Ayatollah Sistani. May Allah subhanahu wa ta'ala prolong his life. This was sent by a group of people, and it mentioned a recommendation that one should drink water more frequently to keep the throat moist as a way of combating the virus. Based on this, they have asked whether it would be okay to skip fasting this Ramadan. The answer has generated a lot of discussion, and I will explain the answer. But before that, let's take a couple of steps back. Firstly, a mujtahid responds to questions even if they are just hypothetical situations. In this scenario, the recommendation for frequently drinking water as a way of fighting the virus has not been seen from any credible medical body. In fact, there are more articles debunking this myth than anything supporting it. This false recommendation is floating around social media more than anywhere else. So take the answer of a mujtahid as a response to a hypothetical situation, not necessarily an endorsement of the so-called information mentioned in the question itself. Also keep in mind that the issue of whether a dry mouth or throat seriously raises the risk of coronavirus is a mawdu'i issue, which needs to be defined as a risk factor by the medical experts. Secondly, the answer clearly says that the perception of fear in this hypothetical scenario cannot by itself be the basis for avoiding fasting in the month of Ramadan. Instead, those who have such a fear should attempt to drink extra liquids beforehand to assist in staying hydrated throughout the day. Thirdly, the answer also states that in order to keep your mouth moist while fasting, you can choose sugarless gum, provided the pieces of gum are not swallowed. Remember that this is a response to a perceived risk of keeping your mouth and throat dry. However, since this is a falsely presented risk, the option of chewing gum becomes irrelevant. So don't consider it to be an excuse to chew sugarless or flavorless gum while fasting, as it will surely diminish the spirit of fasting. On a related note, a question I received earlier regarding fasting was about those who fear that fasting will lower their immune system, thus increasing the risk level for infection by the virus. The answer to this is also clear. They should eat and drink smartly and sufficiently during the night in order to keep their immune system healthy, and then fast during the daytime. Of course, those who are not feeling well due to an illness or are unfortunately infected with the virus are obviously exempted from fasting based on the existing rules of exemption. And so the normal rules of exemption in qada or fidya will apply to them depending on their condition and situation. However, there are those who are at the front line of the war against COVID-19, such as doctors, nurses, and other workers in the ER or long-term senior care homes. They are in a different situation compared to the general public. So if these individuals see that fasting will seriously hamper their ability to treat and care for COVID-19 patients, or they see their job as a serious risk to their own well-being during this crisis, then they will have to evaluate each day of Ramadan individually. They should start the fast normally, but assess the situation throughout the day. If they realize that they cannot fulfill their duties sufficiently, only then can they break their fast. And in this case, there is no kafara for them. They just have to do the qada of the day later in the year. Since I'm talking about exceptional cases of fasting, let me end with a question that I regularly receive before Ramadan about the young girls who turn 9 years old at a time when Ramadan has long days and short nights. If a girl of that age finds it extremely difficult to fast and experiences illness or headaches, for example, then in such cases she will be exempted from fasting. She has to do qada later on, perhaps in the winter when the days are shorter. Finally, if you are unable to fast for a genuine reason, then don't feel guilty. Your health and safety is more important. Allah subhanahu wa ta'ala in the Quran says, وَمَنْ كَانَ مَرِيضًا أَوْ عَلَى سَفَرٍ فَعِدَّةٌ مِّنْ أَيَّامٍ أُخَرٍ. Whoever is sick or on a journey, then he should fast the same number of other days. يُرِيدُ اللَّهُ بِكُمُ الْيُسْرَ وَلَا يُرِيدُ بِكُمُ الْعُسْرَ. Allah desires ease for you, He does not desire hardship for you. For more information on common fasting rulings and questions such as travel, illness, or kafara or fidya, visit the link shown on the screen. Be safe. May Allah subhanahu wa ta'ala bless you all. Wassalamu alaikum wa rahmatullahi wa barakatuh.